Hepatitis A. So we're focusing on hepatitis A virus. So like we mentioned recently, we had a infestation at Panda Express. Cooked in and washed their hands. All right, fecal oral. All right, you're supposed to wash your hands after going to the bathroom, just FYI. Anyways, we got it's the most common hepatitis. So between A, B, C, D, E, F, G, non-A through G, all the hepatitis there are in the world, it's the most common hepatitis. Okay, there's really no treatment for it, right? There is a vaccine, and we can kind of give them a boost as far as give them the vaccine when they get exposed, and hopefully that they will prompt their, it will attack the hepatitis A that's there. Let me see if I can share and unshare. Maybe that'll make it change so we can actually see the content here. Oh, did it fix? No. Not really. Let's stop share and reshare. Oh, it looks better. It's loading. Anyways. All right, so yes, so hepatitis A, it's there's really no official treatment, but you can give a dose of antibodies or a dose of even immunoglobulin to help boost the immune system. All right, it's spread again by how? By fecal oral, right? So how do you get fecal oral contamination? You'll be surprised, right? So failure to wash hands. All right, so failure to wash hands, you're not washing your hands, you're contaminated with hepatitis A virus, which is usually from feces, right? Well, it's 100% from feces. All right, you have contaminated food and water, right? So you have poop water that got there, someone pooped in the pool, right? Or someone didn't treat it at a sewage plant, right? Sewage plants are held to high standards that they are treating the waste and not making a mixture, it doesn't mix in with drinking water, all right? And daycare centers, those guys are swimming in stool, right? So they got to make sure they're washing their hands. And interestingly enough, that kids don't usually get hepatitis A, but they will give it to you, all right? They are great carriers of hepatitis A. So they pick it up in the daycare, they pick it up elsewhere, and they don't wash their hands. You don't see them wash their hands for 30 seconds, right? They're going to then, they can then contaminate adults easily and older people and people that are at risk, right? What else? So household spread because of that. Homeless aren't always washing their hands. They are at high risk of hepatitis A infection. And then water that's contaminated, right? So someone didn't wash their hands, or the water itself. It wasn't treated correctly, like we mentioned, right? Post-defecation gets into shellfish, right? Or if this is your lobster bisque right here, that's not going to be a good way to not get hepatitis A. What else? We have drinking it, right? You drink water that's been contaminated. Also, anal-lingual sex. It's a thing, right? Those of you that aren't aware. So it's a where you're licking a hole, and that is like this guy right here, right? But imagine a human, right? So hepatitis A, right? So it can translate from sex to sex, from anal-lingual sex, but also sex to sex, right? People don't always wash their anal holes, right? So it can then cross-contaminate. Okay, they're not always wash their hands. Like wait, let's wash hands. 20 seconds. All right. Okay, so that could cause a contraction of hepatitis A. Okay. Okay. So yeah. So poop in the pool. We got kids that can do it. We have. You can prevent this altogether if you get a vaccine, right? That doesn't mean that you shouldn't participate in these practices, but hepatitis A usually is endemic to more third world countries. So if you're going traveling, you should get a hepatitis A series, right? It usually lasts you about 5 months, right? If you're traveling, you have to get another dose after that. But either way, you can protect yourself by washing hands and getting vaccinated against hepatitis A if you're high risk. If you get exposed, ironically, you can also get hepatitis A vaccine, and it also works in that fashion. Right, so you can see California and Utah for some reason, and what is this, Kentucky? All right, these guys are greater than 4,000 cases per year, right? And Texas, what are they doing in Texas that's different? Are they don't participate in anal-lingual, or what are they doing? they don't report it. So it's like if you don't do it, it didn't happen, right? So, but it is endemic pretty much all over America. It's actually pandemic. It's across the world. Okay, so you could get ill from farmers, in the field and not wash their hands. They don't have resources to wash their hands. It's a whole situation. But like for instance, we had frozen strawberries in '97, caused 150 people to get ill. Chi-Chi's, salsa and grill. They had the salsa was no bueno, all right? So, no, it's salsa and chili con queso was no bueno. And that caused 555 to get sick, and 3 people died. So it is usually you just get symptoms and you get infected and then you recover. It might take 4 weeks, but you'll get better over time. But those that are immunocompromised, those are higher risk, they're older, they're going to be at much more risk of dying, okay? So hepatitis A is a RNA. As we'll find out, all hepatitis are RNAs except for one, and that is hepatitis B is a DNA hepatitis or virus, whereas the other ones are RNA. Okay, so we're differentiating them where you can say which ones are fecal oral, which ones are blood, which ones go to chronic disease, which ones are RNA or DNA. This will help you with the diagnostic tests, because only one test is a DNA test. That's the one that looks for hepatitis B virus. So it's called the HBV DNA test. We can do an HAV DNA test. We're looking for hepatitis A virus. We're looking for the amount of, did I say RNA or DNA? The hepatitis A virus RNA. We're seeing how many RNA viruses are in the bloodstream, right? Do a little blood test. If you see a lot of RNA that comes from hepatitis A, you have a lot of hepatitis A on board, right? You could do hepatitis A antigens or antibodies, right? Because you form antibodies against the hepatitis A antigen. You form the antibody response, but it takes you a second to form that response, right? It takes about 7 to 10 days if it's your first time. Okay, if you've been exposed to it before, or you have the vaccine, 1 to 3 days, and you form an immune response, and you can get rid of it. Okay, so also flies, they can transmit hepatitis A. So that's a new fear that's unlocked right there, right? So if a fly bug, so don't you dare touch me. You should wash your hands afterwards, right? And then, yes, so washing hands is extremely important.
Jerry, tonight you're in it for a real treat. I'm personally going to prepare the dinner for you and the Mayorri.
Jerry, are you okay?
Huh?
Is anything wrong? You look like you've seen a ghost.
All right, so wash your hands. Cooks you to wash their hands. That's why it's important. All right, any questions on hepatitis A? We're going to talk about some diagnostic tests next. All right, so HAV, what are your symptoms? All right, I guess diagnostic tests are on the next slide, but symptoms of hepatitis. All right, so symptoms are going to be, for hepatitis A, for instance, are usually mild. Usually you overcome it. All right, you're going to get yellow, but you're going to overcome it. Right? So if you get yellow, we don't just call someone yellow, right? In our charting, we call them what? Jaundice. Or if you're fancy, you say they are icteric. Right? So icteric is, is it Icarus that went too close to the sun? Right? So that's why they're yellow. Right? So usually the first symptoms they'll get is the first week, the first 7 to 10 days, right? Because what's happening in the first 7 to 10 days? You're making antibodies against this virus, right? So when you make antibodies, your whole body is making this, right? It's not just one area, and you're working overtime. You use a lot of ATP, a lot of energy. You use a lot of effort to build this immune response, right? So what are you going to feel? You're going to have flu-like symptoms, right? Flu-like symptoms are just when you are creating an immune response, right? So when you get a influenza, you get not so much a cold a little bit sometimes if it's virus related. But any kind of viral infection or any kind of immune response, you're going to get flu-like symptoms, which means you have fever, right? Fever is the immune system is working, right? The immune system is working and it says, well, I'm going to make this immune response. And in the meantime, let me sweat them out, right? Maybe they'll leave, right? So your immune system just fires up and it increases metabolism for one with the excess heat, but it also will bake out the bacteria, virus, protozoa, whatever it may be. Right, so that's just a feature of a immune response, right? So you have flu-like symptoms, means you have fever, chills is associated with fever. You'll feel cold and you will want to bundle up. It is almost like your body's fooling you to make you even more warm to get rid of the infestation, right? Malaise, what is malaise? Yeah, FOS, right? Feeling like FLS, what is that? Feeling like crap, right? So you don't feel great. Okay, so myalgia, what is myalgia? That's body aches, muscle aches, right? What is arthralgia? Joint, right? Your arthrosis, and all the different arthritic joints. You have arthralgia, nausea, vomiting, headache, fatigue. Why are you fatigued? Because you're using a whole bunch of energy, right? You use a whole bunch of energy. You don't have enough energy for your muscles to do activities you normally would, right? Like studying for this test. So you have all these flu-like symptoms, right? And this is for every viral infection ever, every immune response ever. So what do you have? A new achievement, right? You unlock new achievements. So SNS response plus these symptoms, well, shoot, they got a virus, right? And they are fighting out that virus. Sometimes the virus can cause widespread inflammation, and it can be a more pronounced response. But usually every viral response is going to be similar to this, right? So someone who has a hepatitis virus illness or a hepatitis is going to have flu-like symptoms, right? But what else are they going to have? What else is unique about this, right? Because having viral symptoms could be very, very generalized, right? It could be COVID, it could be influenza, it could be, parvovirus, it could be something weird, right? But what makes it hepatitis? Okay, what's that? You could have right upper quadrant pain because the liver is inflamed. Where's your liver at? The right upper quadrant, right? And then the liver is inflamed, so things can't get through that normally would get through. So the liver usually makes bile from bilirubin, right? That's in the bloodstream. Bilirubin gets made, and bile salts get added from the liver, and that bile should make its way into the gut, right? If it doesn't, well, bile makes the poop turn brown, right? That's what gives your poop brown color. If you don't have bile, what color is your poop without brown? It's clay on the right there, right? So clay due to a swollen biliary tree. So the biliary tree that starts the duodenum, or you could say ends, but it really, it goes into the liver. The liver makes all those different biles, or bile salts, and takes bilirubin from the bloodstream, and then we'll add it into the gallbladder, or we'll secrete it down the biliary tree into the duodenum. And if you don't have that, your stools will be clay-colored or pale stools, right? What else happens? Well, first of all, these symptoms come like in 4 to 30 days, but either way, the bilirubin itself backs up, right? And bilirubin usually makes its way into the gut and makes the stools clay, or makes the stools not clay. But also bilirubin, if it can't get into the gut, it's going to make something else turn brown. So it's going to back up and it can't get through. So therefore it goes to the kidneys to get excreted, right? And it makes your urine look tea-colored, right? Or Coca-Cola colored, right? So Coca-Cola urine is usually found in really 2 cases. One of them being liver disease or liver inflammation, and also rhabdomyolysis, which we'll talk about in musculoskeletal for the next exam. But tea-colored urine is usually, almost always, something that's wrong with the bilirubin process, right? It's either bilirubin or it's rhabdo. All right, what else? So this bilirubin is a waste product. So whenever you have a waste product where it doesn't belong, it's going to start getting into things, right? And it starts getting into things, it starts causing those things to get inflamed, all right? If it gets into your skin to get inflamed, that's itchiness, right? We can't just say itchy, we have to say what? Pruritic, right? Pruritic or pruritus, that is itchiness, right? So pruritus is from bilirubin buildup, and also the icteric skin and icteric sclera, right? So this is where your sclera at. Those are your eyeballs, right? The whites of the eye, aesthetically, All right, so the whites of the eyes get yellow, the skin can get yellow. This can be difficult in African American or a darker complexion. So you can look at the eyeballs. Eyeballs don't lie. Okay, and then tea-colored or Coca-Cola urine. Right. So anytime someone has a buildup in bilirubin, you can also copy and paste. They're going to have these symptoms. Right. They're going to be icteric. They're going to have pale what? Pale urine or pale stool? Pale stool, or dark urine, or tea-colored Coca-Cola urine. Right. Because the bilirubin can't get through into the gut, therefore it backs up and it goes into the blood, stays in the bloodstream, and then gets rid of, and is gotten rid of in the kidneys, right? So jaundice, how does jaundice happen, right? So you do have two types of bilirubin. You have direct and indirect, and in OB, for those of you guys that went to OB, that's where you talked about indirect bilirubin, right? Being built up because the baby was breaking down RBCs way too much, right? And we break down an RBC. Inside of an RBC, there's heme and there's globin, right? So the heme is what gets converted into, needs to get packaged up and brought to the liver to get discarded as waste. But in the meantime, until it gets to the liver, it is unconjugated. It is just floating in the bloodstream, right? And we'll talk about other reasons why you might break apart RBCs as an adult, like in sickle cell disease is a reason. In certain autoimmune conditions where you're attacking your RBCs and you're breaking them down, your bilirubin goes up and they get jaundice-like symptoms, right? But hepatitis, the reason why it goes as, you just have a buildup of all the bilirubin, which is the total bili. So the total bili, indirect and direct. You can measure both, but really we don't care, all right? So it's the total bili. How is your bilirubin high? Yes, and then you can then do some more studies to figure out, well, is the indirect high or the direct high? But right now, for our purposes, we just want to know, is the bilirubin high, right? And that value is like greater than 2.5. Usually when you're greater than 2.5, that means you start getting jaundice skin. You get icteric skin. Okay, and then direct bilirubin, that's what the liver has processed. The liver has taken the bilirubin from the serum, from the bloodstream, processed it, and made it conjugated, right? It conjugated it. It completed it, you could say, right? And when it completes it, it makes it water soluble. And you can handle things that are water soluble really easily in the bloodstream. You can attach it to a protein transporter and get rid of it, okay? So that's the deal there, okay? So in in hepatitis, you can't give, you might be able to conjugate just fine. You might be a little bit impaired because your liver cells are swollen and they don't want to make bilirubin or conjugated bilirubin. But either way, you have the inability to get bilirubin through the liver because it's so inflamed and so swollen shut that bilirubin can't get through. If bilirubin can't get through, then it can't get to the gut, and therefore your stool in the gut is clay colored. Also, the other thing that happens is you have bacteria in the gut that break down that bile, that bilirubin specifically, and turn it into what's called urobilinogen. And urobilinogen is a test we can do on the kidneys, right? On a UA, and you can see how much urobilinogen do they have, right? So if no bile got to the gut, is there going to be a lot of urobilinogen in the kidneys? No, because this urobilinogen usually gets excreted, but some of it gets reabsorbed into the bloodstream and makes its way to the kidneys to get excreted also, right? So it'll be when you have a blockage of bile going through the liver, then the bacteria in the gut is not going to be able to chomp on that, and when it chomps on it, it excretes out urobilinogen. So the urobilinogen will be low when you have a biliary obstruction, okay? So what else? So what is bile in the first place? And we'll circle back to this when we talk about the gallbladder. But the gallbladder stores bile for later, for a fatty meal, right? So what does bile do? It has bilirubin, which is just a waste product, right? It's from excess. You're breaking down RBCs all the time. If you're breaking down excess RBCs, yes, your bilirubin will go up. But you're always making bilirubin. It's always a waste product, right? So bile has bilirubin in it, which makes the stool brown, right? And if it can't make the stool brown, it'll make the urine brown. But either way, it also has other important things such as bile salts, bile acids. And these bile salts are what emulsify fat. It makes it so that the fat is able to be latched onto and broken down so we can absorb our fats, right? So that the enzymes from our pancreas can work on those fats, okay? So we mentioned it gives stool its brown color, right? If you're unable to secrete it, right, because you have inflamed ducts, you're going to have pale clay-colored stool. and then urobilinogen will be low on the with an obstruction, right? If you can't produce, you can't, like your liver, like in liver cirrhosis, right? That's a next step of hepatitis B or C, for instance, or alcohol or fatty liver, and your liver gets cirrhotic, it can't conjugate anymore. It can't make bilirubin, right? So it can go, so in cirrhosis also you have elevated bilirubin. So we're just going to copy and paste this for our cirrhosis patients also. Okay, so eyes will be icteric, urine will be tea-colored, skin will be jaundice, right? When you're talking about neonates and peds and such, they can get, the bilirubin can make its way to the brain and cause, it's literally just poop that's gone everywhere, like a dog on a Roomba, right? It's gone everywhere, right? And it's going to cause you to be inflamed, but also all those areas are going to be inflamed if it's tissue, right? So like the brain tissue, for instance, can be inflamed, especially in neonates. Okay, any questions on bilirubin and jaundice? Okay, so diagnostic tests. So you have, this is for hepatitis A. All right, so hepatitis A, you're going to have elevated bilirubin. Why is it elevated? Because it can't get through, right? It can't get through the liver to get excreted in the stool. Therefore, when we measure the bilirubin on blood tests, it's elevated, right? If we look at the UA, we can do the little dipstick on the UA, and we can look at urobilinogen. And that tells you, is bile making its way to the gut, right? Because when it does make its way to the gut, the bacteria eat it and they excrete out urobilinogen, which gets absorbed into the bloodstream and get excreted by the kidneys, right? And then AST, ALT. So we're going to spend a second talking about AST, ALT on this slide, because then whenever in the future we talk about AST, ALT, you just refer back to this and this will apply. You just copy and paste what you know about AST, ALT, right? So AST, the mnemonic is AST. All right, so what elevates AST is A for alcohol, S for statins, and T for Tylenol. You could put A for acetaminophen too, but you're going to throw yourself off. Right, so yeah, AST here in the bottom right corner. All right, so we have alcohol, statins, and Tylenol. That will raise AST more than ALT. So when you look at AST, ALT, they can both be elevated, but really what's important is like which one is higher. Because if one is higher than the other, that means like AST is higher, that means it was either alcohol or what else was making that AST high? Statins or Tylenol, right? And how much Tylenol should you take per day? Less than 4 grams. What's a statin? It's a cholesterol medication, right? So everybody's on a statin because nobody does diet and exercise. All right, so everybody gets a statin. All right, so AST will rise when you have an insult to your liver. That's because of alcohol, statins, and Tylenol most commonly, right? AST is found in many, many different cells. It's found in the heart, actually more than the liver. So back in the day, in the 60s and 70s, they didn't, troponins only came out like the late 60s, but we had ASTs, and we could see the AST was rising. Well, maybe, and they have chest pain. Well, maybe you probably have a heart attack, right? So AST is a test that if you look at patients that have heart attacks, their AST is going to be elevated, right? But troponin is a better test. It's more specific. It's actually, the troponin comes right from the cardiac muscle, right? So it's also found in skeletal muscle. So when we talk about rhabdomyolysis for the next exam, right, rhabdo is going to have an elevated AST because it's skeletal muscle damage, right? And the kidney and pancreas also produce AST when they're damaged, right? But it's found in the mitochondria of liver cells. So it's not just found just in the liver cells. It's found specifically in the mitochondria. If you have one liver cell, is there one mitochondria in there? No, there's multiple mitochondria, right? There's hundreds of, not thousands, of mitochondria per cell, right? Because alcohol is going to damage your liver cells and kill one liver cell, but it's going to kill more mitochondria than liver cells, right? So your AST, ALT will go up with alcohol, or with hepatitis A, your cells are dying, but your more mitochondria are dying than cells, right? So the mitochondria die first. They release their enzyme, which is what? Aspartate aminotransferase, good job. All right, so AST, right, that's going to rise more than ALT because if it's an alcohol, works on the mitochondria, statins work on the mitochondria, and Tylenol works on the mitochondria. By work on, I mean damage and kill, right? So it damages it and therefore it spills into the bloodstream, and we can measure the amount of AST and, of course, ALT, and AST will be greater or less than ALT. It'll be greater than, right? So that's AST, right? So it's important to know the difference, right? And you can notice that DILI, drug-induced liver injury, so DILI, right? Most drugs will damage the mitochondria, such as, which one of those is drugs? Statins or Tylenol, right? So then ALT. So the ALT, luckily, L for liver, it only comes from the liver, right? So when you have damage to your skeletal muscle, ALT is not going to rise, AST will rise, right? When you have damage to a liver cell, ALT will rise, right? So just damage to the liver cell itself, to the hepatocyte itself, right? So ALT will rise usually when the cell, now the mitochondria, is being damaged and apoptosed. What does apoptosed mean? It means programmed suicide, right? So it's like be Jeffrey Epstein, right? So you're going to say, you know what? You are going to suicide now, all right? Go, all right? So that is apoptosis, right? So the cell has been programmed to die because it's inflamed and it's infectious, right? It has things that it has done wrong in its past life. Either way, we have viral cells. Viruses don't always attack the mitochondria. They attack the cell itself. They attack maybe like the endoplasmic reticula, like Hep C does. Hep A attacks gets inflamed inside the cytoplasm. Okay, and that's going to cause the virus to eventually be apoptosed, and it will die and spill its contents being ALT. Yes, there's some AST in there, but the virus wasn't attacking mitochondria like the drugs were. The virus is attacking the cell itself, right? So when you have a viral with an L infection that attacks liver cells, then it's going to cause a rise in ALT. All right, does that make sense? All right, so when your diagnostic test for HAV, you can look at bilirubin levels to be high. The T-bili will be high. If they're jaundice, you expect the T-bili to be how high? Greater than 2.5, right? Your total bili will be high when you have a HIV infection. And then AST, ALT will be high. Which one in HIV do you expect to be higher? ALT, right? And then hepatitis panel, right? So that's where we're looking for specific hepatitis, right? So we don't know, we know they're jaundiced, and someone's jaundiced and they don't have cirrhosis, like they're like 25 years old. You know, it takes about 20 years to get Hep B, Hep C cirrhosis, right? So they might have Hep A. Okay, they could have Hep B, Hep C. Hep B, Hep C can have that presentation, but most commonly it's Hep A. So we do a hepatitis panel. We do a panel just assess for all the hepatitises. We can look for the amount of RNA or DNA. Which one's DNA? Hep B, right? But we can do a hepatitis A RNA amount. How much hepatitis A do they have circulating around? How much hepatitis B do they have circulating around? How much hepatitis C do they have circulating around, right? And also, it's been a second because it takes about, 4 to 30 days for these symptoms to develop, right? They should have an immune response, right? When you have an immune response, you produce what? Antigens or antibodies? You produce antibodies against the infestation, right? So the first thing you produce is IgM, right? So M is first. It is the first antibody you produce. And that antibody is specific. It doesn't attack anything else, right? I mean, yes, there are certain things like post-streptococcal glomerulonephritis where you're producing, somebody gets the strep and it also attacks your kidneys, but no. This is an antibody only against hepatitis A, right? And how long does it take? About 7 to 10 days. So look at that, 1 week, right? 7 to 10 days. That's when you're going to have an increase in that antibody, right? So the antibody against HAV, right? So we abbreviate that as anti, right? HAV, right? So IgM, which happens first, or is the first immune response. But actually, you can actually see spillage of antibodies into the stool. We can actually do a fecal HAV. And that's actually first, right? So if you look at fecal HAV, it's actually appears much sooner, right? Almost half a week sooner than the IgM, right? And then if you'll be immune to HAV for about 5 months or so. If you got the vaccine or if you had been exposed. So if you go to Chi-Chi's and then 4 months later you go to Panda Express, you're good, right? Because now you have you'll form an immune response immediately, like in 1 to 3 days, and you have this, and you also have that antibody already ready to go, ready to attack any kind of HAV that might get into your system, right? And IgG is what's there for a long time. G is for great. G is for it takes a while to build, right? Like 21 days almost for you to actually have a good amount of it. But the IgM is just there acutely. You can fit an A, I think as the slide I put the mnemonic, maybe not, but you can fit an A in the letter M. So if you put M for IgM and G for great, you can fit A as the acute process, right? And G is the chronic process, IgG. So that's another way to memorize which one's which. Yes?
So will ALT be rising first, or are they rising concurrently with IgM?
ALT will rise with an acute infection and hepatitis, right? Whether it lines up or not, it'll probably be, if they are really inflamed, yes, you'll see all of those elevated, and it's been the right amount of time.
Would it be a good early indicator?
Yeah, and it takes like 4 to 30 days for that inflammation to happen and to get to the top peak effect. Okay, so we can do antibodies against hepatitis A virus, right? And you have form 2 antibody responses, IgG and IgM. Which one's first? IgM, right? So that's the one that happens acutely, and that's going to rise, and you can measure that to see if someone is infected with hepatitis A. And you notice IgM goes away in about 21 days, and now we have IgG that's taken over, right? So we can measure IgG to see if they've been exposed to it in the past, right? And if we have IgM present, that means it's there for the last 20 days or so, right? So that's one way we can assess if someone has a hepatitis A infection, right? So this is important to understand because hepatitis B is ridiculous, right? It has all kinds of antibodies, the antigens, right? So hepatitis A is what's easy, right? Hepatitis A, you could assess the antigen, but we don't really assess the antigen of hepatitis A. We assess the viral load, how much hepatitis A RNA is there circulating in the bloodstream, or how did we create an antibody response to it? And the antibody response could either be IgG or IgM, right? Which one's acute? IgM. And which one is a chronic response, like they were exposed in the past? That's IgG. So it's anti-HAV IgG, right? It's the antibody against hepatitis A virus that is IgG variety, right? Because you can have an IgM variety. Yes?
On here it says for IgM it lasts about 6 months. Is it like 21 days?
It varies based on the disease process. Yes, that's accurate. So it's 6 months for IgM. Yeah. But yeah, no, it depends. On average, it's about 21 days, 21 to 30 days for IgM, but some disease processes last longer, right? Like you have to get a booster for Hep B, right? You have to get a booster for tetanus, whereas you don't have to get a booster for, what's something else, diphtheria? When if you like a diphtheria booster, right? You probably do, but either way, you can measure your titers, right? You can measure your titers before you go into the nursing program, before you go to work, and your titers are looking at what, IgG or IgM? IgG, which is the gradual one that takes effect after you formed an immune response, and if those are low, we're gonna give you a little booster shot, right? So when you get hepatitis B series, right, it's 0, 1, and 6 months, and it has to be increased in your bloodstream. You have to form that immune response. Yes.
So what determines if someone, the shots don't work, like for Hep B?
The way you know it's not working is you look at their titers.
Right, but like what's going on with their body to make it not?
They could be immunocompromised. They could have a poor response, right? So there's many different factors, but usually it will stay elevated. I mean, those immunocompromised have to get more boosters more frequently. Okay. So yeah, so we have hepatitis A vaccines that we give as the treatment for an HAV infection. All right. So we just give them the IgG basically. Okay. And if you're going to go to an area that has HAV, you can give a little dose of the antibodies, right? So they are protected for about 5 months or so. Okay. So usually 90% recover spontaneously. 99% just spontaneously recover. They're fine. There is that little 1% that won't respond, and they can even die from it. Yes?
Does HAV stay in your bloodstream forever?
The virus itself?
Yes.
No, it goes away.
It goes away.
Yeah, so the HAV virus, I think it might be here. No, it's not. But HAV virus also depletes over time.
Okay.
Yeah, so that could tell you you don't have an active infection, right? That the hepatitis might not be due to HIV because the virus is even in there. Okay. All right, does that make sense? All right, so we're going to do hepatitis B next. Hepatitis B takes this concept and blows it up to 1,000. Yes? Some vaccines provide the antigen, and some vaccines provide the antibody. It just depends on the vaccine and which one they've done for the research, which one has the best response. All right? Something like influenza is attenuated. They're giving you the antigen into your muscle, and then you form an immune response against it. You feel crappy for 1 to 3 days because you're making antibodies, right? And then you'll eventually form the IgG against it for the flu season, right? Same thing with COVID vaccine. You have a dead one, which is what the Pfizer one was, and the other one, not Bacteria, what's the other one I'm thinking of? Moderna, right? It was actually a new type of one where it actually gave you the instructions to make the antibody. It said, here's the instructions. You don't have to form an immune response. Here are the instructions to make the antibody. Okay? All right, so that's HAV. All right, so that 99% recover, right? But there is that 1% that do not recover and can get what's called fulminant liver failure. And fulminant means you have a hyperacute liver failure. Your liver failure goes to level 3000. It just goes overboard, right? You actually are getting a huge immune response, and you can even die from this, right? So you have an HAV infection, all right? Usually 99% recover, and only about 70% actually get symptoms, get the jaundice, get the flu-like symptoms, and of those, only less than 1% actually get acute liver failure, and they may even need a liver transplant because of how sick they got, right? So these are, when you have acute liver failure, it means your liver has failed completely, and you look like a patient that actually has had liver disease for a long time, that someone that has end-stage liver disease, that has like profound liver cirrhosis, right? So we're going to have some overlap with the symptoms with fulminant, which is called hyperacute liver failure, right? Where your liver has failed completely. Obviously, you get jaundice because the liver is inflamed, right? So we can measure the T-bilirubin high. You have all the symptoms of jaundice, which is going to carry over from before. But the other thing the liver does is forms coag factors, right? So and it also stimulates platelet function, or platelets to be produced. Like your kidney produces what to make RBCs? What does your kidney produce? Erythropoietin. So to make our platelets get produced, we produce thrombopoietin, right? So it's called TPO. So thrombopoietin is not getting produced, and TPO gets produced by the liver. Also, the liver makes all kinds of coag factors, which help you clot, right? You don't get that if your liver fails, so you can be coagulopathic. Okay, and then HE. We have a whole slide dedicated to HE when we talk about complications of liver cirrhosis. HE stands for hepatic encephalopathy. So that's where the liver processes ammonia, and if it can't process it, ammonia builds up, and they get neurosymptoms. Okay, so those neurosymptoms can then progress to be altered to a comatose state. Right. Also, that ammonia can potentiate cerebral edema. Okay, so these are symptoms you look for with acute liver failure, and there's all kinds of scoring systems out there that identify a patient as, on a scale of whether they really need a liver transplant or not. Right. And they have to be other criteria as well. But these are different things. You punch into a database, you punch into an MD calc, and you see how bad the liver failure is, right? So for instance, there's King's College criteria, there's MELD plus, there's MDF. You don't have to know these. These are just things that is part of the management. You have to put it into a scoring system, and they have to be transferred to a transplant center to get their liver transplanted, right? The higher the score, the higher the need for a transplant. Okay, so what else on here? So acute liver failure. You have the INR, which measures what? Measures coagulopathy, right? So it measures how coagulopathic they are. So INR is really high. That means it takes a long time to what? To clot or bleed? A long time to clot, right? That's how long it takes them to clot. And then also acute liver failure, technically they could get this, right? When you say someone has an acute disease process, right? How long do you think that is? All right, so is it like 7 days, 5 days, 24 hours? 40 hours, right? Like chronic pain is, 3 months, right? 6 months maybe. What do you think it is for acute liver failure? It's 26 weeks. So if you get these symptoms within 26 weeks, congratulations, you have acute liver failure, right? And you can see in the bottom red box there, drugs are usually the most common reason for this. Hepatitis can, right? Hepatitis A it's rare, but usually we're kind of leaning more on drugs such as paracetamol. That's if you're British, right? In Britain, what is paracetamol? That's Tylenol, right? Acetaminophen. They just, use Pig Latin, I think. All right, so yeah, so acute liver failure can develop because of really any hepatitis, really any insult, but most commonly it's due to a drug overdose. Okay. So acute liver failure and chronic liver failure on the bottom right there, these are different, they're very, very similar, and we'll spend a whole deal on chronic liver failure. But acute liver failure has the same symptoms. They have the hepatic encephalopathy, they have the coagulopathy, and they have the jaundice, which are numbers you can punch into a scoring system to figure out if they need to get a liver transplant or not. HELLP syndrome is up there for those who came from OB. You know, it's actually an autoimmune process that attacks the liver and causes hepatitis. And your platelets are low, right? LP for low platelets. They have elevated liver enzymes, and they have hemolysis. So hemolysis is the autoimmune process. That's not like unique to liver failure, but just to kind of connect the dots with HELLP. And they can, if they develop that, then they might need a liver transplant, right?